Welcome back, viewers. Today's topic is on lung cancer and the third part of the cancer series. With an estimated 2.2 million new cancer cases and 1.8 million deaths, lung cancer is the second most commonly diagnosed cancer and the leading cause of cancer deaths in 2020. Among men, lung cancer is the most commonly diagnosed cancer in 36 countries, while it is the leading cause of cancer death in 93 countries. What is cancer? I have filmed a video to explain this in detail. I recommend you to watch that. The link is in the description. Our lungs are two sponge-like organs in our chest. The right lung has 3 sections and the left lung has 2 sections. These sections are called lobes. The left lung is smaller because our heart takes up room on the left side of the body. When we breathe in, air enters through mouth or nose and goes into our lungs through the trachea, also called windpipe. The trachea divides into tubes called bronchi, which enter the lungs and divide into smaller bronchi. These divide to form smaller branches called bronchioles. At the end of the bronchioles are tiny air sacs known as alveoli. The alveoli absorb oxygen into the blood from the inhaled air and remove carbon dioxide from the blood when we exhale. Main function of lungs is to take in oxygen and get rid of carbon dioxide from our blood. The majority of human beings are born with a pair of lungs that work perfectly fine until their last breath. Unfortunately, some people get lung disease or even lung cancer due to their lifestyle, profession, or family history. About 50% to 60% of lung cancers found in people who never smoked, or adenocarcinomas, cancer that begins in the cells that line the lungs' tiny air sacs and make substances such as mucus. About 10 to 20% are squamous cell carcinomas, cancer that forms in the thin, flat cells lining the inside of the lungs. The 6 to 8% are small cell lung cancer, and the rest are other types of lung cancer. The main reasons of lung cancer in non-smoker patients are secondhand smoke, exposure to certain chemicals, family history, and air pollution. If you are interested to know more about harmful chemicals that can cause cancer, I have filmed a video on the subject. You can watch that by clicking the link in the description. Different people have different symptoms for lung cancer. Some people have symptoms related to the lungs. Some people whose lung cancer has spread to the other parts of the body have symptoms specific to that part of the body. Some people just have general symptoms of not feeling well. Most people with lung cancer don't have symptoms until the cancer is advanced. The main symptoms of lung cancer include a cough that doesn't go away after 3 weeks, a long-standing cough that gets worse, persistent chest infections, coughing up blood, an ache or pain when breathing or coughing, persistent breathlessness, persistent tiredness or lack of energy, loss of appetite, or unexplained weight loss. Then there are some less common symptoms of lung cancer that include a high temperature of 38 degrees centigrade or 100.4 Fahrenheit or even higher, difficulty swallowing or pain when swallowing, wheezing. Wheezing is a sound some people make when they breathe. A hoarse voice. Normal people, when everyone is healthy, they have a normal voice. But if someone has a sore throat or throat infection, their voice changes. That's called hoarse voice. Then swelling of face or neck, persistent chest or shoulder pain, changes in the appearance of fingers, such as becoming more curved or their ends become larger. This is known as finger clubbing. Other changes that can sometimes occur with lung cancer may include repeated spells of pneumonia. Lung cancer can cause additional symptoms if it spreads to other parts of the body, like brain, liver, bones, or lymph nodes. If it spreads to other parts of the body, these are called advanced lung cancer symptoms. It can be dizziness, drowsiness, feeling mentally confused, seizures, bone pain, or jaundice. Jaundice is the yellowing of the skin and the whites of the eyes. Swelling of lymph nodes in the chest and neck, a feeling of weakness in arms and legs. Cancer that begins in the lungs is called primary lung cancer. If it spreads to other parts of the body, it is called metastatic lung cancer. There are two main types of primary lung cancer. They are non-small cell lung cancer, which is the most common type, accounting for more than 80% of cases. Small cell cancer is a less common type that usually spread faster than non-small cell lung cancer. Treatment depends on the type of cancer, how far it has spread, and how good the patient's general health is. If the condition is diagnosed early and the cancerous cells are confined to a small area, surgery to remove the affected area of lung is usually recommended. If surgery is unsustainable due to the general health, radiotherapy to destroy the cancerous cells may be recommended instead. If the cancer has spread too far for surgery or radiotherapy to be effective, chemotherapy is usually used. Targeted therapy is another option besides chemotherapy. Drugs are used to block the growth and spread of cancer cells. The drugs can be pills to take or medicines given in the veins. The tests are done to see if the targeted therapy is right for the cancer type before this treatment is used. Choosing the treatment that is right for the patient may be hard. The patient needs to talk to their cancer doctor about the treatment options available for the type and stage of cancer. The doctor can explain the risks and benefits of each treatment and their side effects. Side effects are how our body reacts to drugs or treatments. Prevention is better than the cure. If you smoke, the best way to help prevent lung cancer and other serious conditions is to stop smoking as soon as possible. However long you have been smoking, it's always worth quitting. Every year you don't smoke decreases your risk of getting serious illnesses, such as lung cancer. After 10 years of not smoking, the chances of developing lung cancer falls to half that of someone who smokes. Research suggests that eating a healthy diet can reduce the risk of cancer and heart disease. There is also strong evidence that regular exercise can lower the risk of developing all types of cancer. If you want to know more about duration and recommended exercise type, please watch my video on exercise. The link is in the description. Lung cancer mainly affects older people. It's rare in people younger than 40, and the rates of lung cancer rise sharply with age. Lung cancer doesn't usually cause noticeable symptoms until it's spread through the lungs or into other parts of the body. This means the outlook for the condition isn't as good as many other types of cancer. Overall, about 1 in 3 people with the condition live for at least a year after they are diagnosed, and about 1 in 10 people live at least 5 years. Survival rates can vary widely, depending on how far the cancer has spread at the time of diagnosis. Early diagnosis can make a big difference. Some statistics on lung cancer: 7 out of 10 people who are diagnosed with lung cancer are smokers. That is 70% of lung cancer patients. Unfortunately, 1% of passive smokers, also known as secondhand smoke inhalers, are diagnosed with lung cancer. A pack a day smokers have 25 times higher risk of getting lung cancer compared to non-smokers. In some Asian and African countries, people smoke water pipe tobacco. Their chance of getting diagnosed with lung cancer is twice as compared to non-smoker. That water pipe is called shisha or hookah. Asbestos workers have 77% chance of getting lung cancer. If someone is exposed to silica, their risk is increased to 68%. Then professional drivers, petrol pump workers, mechanics, or anyone who is exposed to diesel and diesel fumes on a regular basis, their risk is 20 to 40%. And for painters, the risk is 20 to 50%, and welders have a 25% risk. Air pollution is a factor in lung cancer, where people living near main roads have a higher lung cancer and mortality risk. Then the unfortunate factor of family history. People who have a family history of lung cancer are a very high risk of this disease. The risk is 20 to 80%. Some of the medical conditions related to lungs, such as pneumonia and COPD, are also associated with lung cancer. People who suffer from pneumonia have 50% higher risk of getting the disease, whereas COPD sufferers are 50 to 100% at risk depending upon their smoking history and lifestyle factors. COPD is chronic obstructive pulmonary disease. Clinical studies have shown low HDI level has high incidence and mortality rates as compared to high HDI level globally. Even in developed countries, the low income group population has high incidence and mortality rate, mainly due to obesity, poor unhealthy diet and lifestyle. This concludes the third part of the cancer series. I recommend you to watch the rest of the episodes on this series, which covers the history of cancer, chemicals responsible in cancer development, and most common types of cancers globally. If you found this video informative, you can share with your family and friends and subscribe to this channel for more informative content. Thanks for watching.